I think being able to help others and being given the privilege of being a doctor and being able to use those skills to help others is a privilege that one doesn't ordinarily have. And I think we're blessed to be able to use those skills to help others, to make others be able to see, to make their lives better, to be able to go on missions and help people who otherwise may not have access to medical care.
Bright, innovative, dedicated, compassionate, a doctor's doctor. These are the words other doctors use to describe Dr. Jorge Camara. He comes from a family of physicians, the first of 12 children. George G. Camara was born in Ann Arbor, Michigan, when his father was a cardiology student from the Philippines. He received his first lessons in medicine as a child, when his father took him on his Sunday rounds at the Makati Medical Center in Manila. Those first lessons were about kindness and caring.
I look up to my father tremendously. He always has been a role model. He's always been my idol. He inspired me to always do my best, to give my best. And it's through his inspiration that I decided to become a doctor, and I, to this day, look up to him and try to live up to the great example that he set for me.
He studied medicine at the University of the Philippines, graduating in 1976, the valedictorian in a class of 200. The Philippine Medical Association named him the most outstanding graduate. It would be the first of many honors. 5 of his siblings would take up medicine, carving out careers in various specialties. George was fascinated by the eye. At age 26, he went to Baylor College of Medicine in Houston to study ophthalmology.
Well, I've always been fascinated by the eye and how the eye works and how one sees. And as I went through med school, I was torn between being a cardiologist like my father or doing something different. And I eventually, when I was an intern, chose to specialize in diseases and treatment of the eye. And I guess I turned that fascination into my profession.
Invited to Hawaii in 1982 to join the staff at Straub Medical, he fell in love with the islands. He opened his own practice in 1987 with the help of his wife, Virginia, also a physician. Today he heads the ophthalmology department at St. Francis Medical Center and is an associate professor at the University of Hawaii School of Medicine. On a normal workday, Dr. Camara sees dozens of patients and performs up to 6 surgical procedures. Some patients who cannot afford his services receive it nevertheless. Dr. Camara's greatest satisfaction comes from work done as a member of the Aloha Medical Mission in such countries as the Philippines, China, Vietnam, Laos, Cambodia, and Bangladesh. It's an undertaking he calls medicine in its purest form, care that does not ask for compensation.
The Aloha Medical Mission was founded in 1983 by a group of 6 physicians led by Dr. Ramon C. It was born out of a need, out of a perceived need to help people in the Philippines, where we started, that did not have access to medical care. The work has certainly been, I would easily say, one of the most gratifying experiences of my whole career. To see patients who would otherwise have no access to medical care, to see blind people who you know very well could see if they had not just a doctor but had the money to be able to pay for those services. Or to see a mother holding in her arms a child disfigured by a cleft palate, the child being a virtual social outcast because of the appearance of her child. All of these things are such moving examples of patients we've been able to help on these missions, and that make many of our volunteers go back year after year after year.
As many as 60 volunteer doctors and 35 nurses, mostly from Hawaii, are assembled for each mission, which to date have helped more than 20,000 people. Dr. Camara has been a vital part of this effort since 1987. Dr. Camara has been an innovator in his field, taking advantage of promising new technology to treat difficult eye conditions with precision and speed. He developed and perfected a quick, non-invasive laser procedure to restore blocked tear ducts and has relieved hundreds of patients from the chronic and sometimes dangerous aggravation. Just this year, he published a study on a previously overlooked but apparently common problem suffered by many older persons of Asian ancestry whose eyelashes turn inward, causing damage to the cornea. Rather than bask in a well-earned spotlight, Dr. Camara is eager to share his knowledge and discoveries with others so that more people can be helped. In 1998, his surgical skills during a tear duct operation at St. Francis Medical Center in Honolulu were captured live by endoscopic cameras and seen via video by 50 physicians in Manila, anxious to learn the procedure themselves. In 1999, he became the first doctor to use telemedicine to guide from Oahu a surgeon on the Big Island in removing a tumor from the eye socket of a 16-year-old girl. Her sight was restored. Through the University of Hawaii School of Medicine, Dr. Camara teaches specialized procedures to ophthalmologists from the Philippines. 20 doctors are now using those skills back in their homeland.
Well, it's been a great privilege to have, over the years, taught medical students from our University of Hawaii School of Medicine. In fact, quite a few of them have gone into ophthalmology. I teach residents as well, surgical residents who rotate in ophthalmology. And we have the fellowship training program for ophthalmologists from Southeast Asia, primarily from the Philippines. Many of these countries, I learned in the Aloha Medical Mission, do not have specialty training in ophthalmic reconstructive surgery. So it's been a great privilege to have been able to provide the Philippines with the fellows that we've trained. The other part of that is that these fellows can now run our missions. I think one of life's great pleasures in terms of teaching is to make oneself dispensable. And on many of our missions, our fellows can now run these missions with what they've learned during their 6 months to a year stay here in Hawaii. And they simply report back to me on the success of the mission.
Dr. Camara's work has earned him deserved recognition. In 2001, the Hawaii Medical Association named Dr. Camara Physician of the Year. That same year, the President of the Philippines presented him with the Presidential Award for his medical contributions to that country. In 2002, he received the Outstanding Humanitarian Service Award from the Hawaii Ophthalmological Society and also the Outstanding Humanitarian Award from the American Academy of Ophthalmology. In 2003, Maryknoll School is proud to honor Dr. Jorge Camara with the 2003 Noblesse Oblige Award for service, for he lives up to the meaning of the honor's title. To whom much is given, much is expected. Indeed, he has given so much more than expected.
I've been blessed to have been given the privilege to do all I've done. I think that I owe a lot to my family, my mom and dad when I was growing up, my wife now who supports me, my son who has been the joy and is the joy of our life, and all the wonderful people, the staff I work with, my patients, the people of Hawaii, the people around the world whom I've had the privilege of being in touch with. I just feel tremendously grateful, and most of all to the good Lord who has given me all of His blessings. I'm at once very, very honored and very, very humbled by this whole award.